Hello, listeners. From the RSNA, this is the Radiology Cardiothoracic Imaging Journal podcast. I am your host, Praveen Ranganath, and I am a radiologist from Dallas, Texas. In this podcast, we explore research advances and technical developments in cardiothoracic imaging through conversations with our authors, our editors, and experts in the field. Enjoy. Hi, listeners. On today's episode, we will be exploring the Cardiothoracic Imaging Fellowship selection and application process in the United States. Joining me is Dr. Maria Clara Lorca, who is a member of our journal's trainee editorial board. She will be providing her perspective on this fellowship process. Let's jump into that conversation now. Okay, welcome back, listeners. With me now, I have Maria Clara Lorca, who is a third-year resident from the University of Rochester in New York. Clara, thank you so much for coming onto the podcast and helping with our discussion in navigating cardiothoracic imaging fellowships.
Hi, nice to meet you. Thank you for having me.
Of course, Clara, thank you. Why don't we begin by learning about your journey in training thus far that has led to your interest in cardiothoracic imaging?
Sure. So I'm from Brazil, and that's where I went to medical school and did a radiology residency. Then I moved to California, where I was privileged to do a research fellowship with Dr. Karen Ordovas at UCSF. I stayed there at UCSF for 3 years. Dr. Ordovas taught me so many things in radiology and beyond, ranging from research to education to mentorship, and she instilled in me the appreciation for cardiothoracic imaging. I had the chance to work on different projects with her, as well as with Dr. Charles Higgins. During that time, I was also lucky enough to see Dr. Richard Webb and Dr. Higgins sorting and teaching the residents. So having this unique opportunity to learn cardiothoracic radiology from pillars of the cardiothoracic community was what reinforced my desire to do a radiology residency all over again here. And now I've matched. I did a 1 year of surgical internship, and I'm a third-year radiology resident at the University of Rochester, New York. And I will be a cardiothoracic fellow at MGH.
Fantastic. So it sounds like mentorship was a critical component of fostering that interest in cardiothoracic imaging for you. I'm sure that many of our trainees out there can attest to the power of mentorship in developing an interest in a specific area of radiology, in this case, cardiothoracic imaging. I wonder if there were any components of clinical cardiothoracic imaging or even research that you experienced that helped foster that interest even further. Can you speak to any either clinical experiences or research interests that drove you towards it?
Yeah, I did a very interesting epicardial fat measurements by that time at UCSF, and how we could use the epicardial measurements to see with independent risk factors for cardiac disease, for example. I have seen Dr. Dovas, Dr. Hobbs here at University of Rochester, Dr. Kapfa Josling, other mentors that I fostered here, do so many different clinical cases and, for example, avoid, with their diagnosis, avoid unnecessary procedures like biopsies of a pericardial cyst, for example, that for us is super easy, but like it changed their approach to cardiothoracic imaging, changed everything, like it was safe for the patient. So this led me to a very much interest in cardiothoracic. I think, yes, indeed is important.
Fantastic. All right, then before we dive into talking about fellowship programs themselves, let's talk about if a fellowship is even needed. So, do you feel that dedicated fellowship training in cardiothoracic imaging is needed to practice cardiothoracic imaging?
Yes, I do. I really think that in order for any radiologist to become highly functional in thoracic and cardiac imaging and be able to confidently read complex cases in a timely fashion, you would benefit from a fellowship. I understand that several radiologists choose not to pursue this cardiothoracic fellowship. But from my perspective, in the beginning, they end up relying on a good cardiothoracic mentor or from mentorship from professional societies like STR, NASCI, SCMR, SECT. So by the end, in my perspective, is the difference ends up being doing an official 12-month fellowship versus being on your own and relying on an official mentorship for an indeterminate amount of time. So I think we need it, especially in complex cases, congenital cases. How are you going to just finish graduate residency and open a very complex congenital case, for example, and read it and confidently tell the surgeon that this kid is okay or not, or the kid still needs some surgery?
Great. So let's move then to talking about those fellowships. As both of us know, fellowships are extremely heterogeneous in a variety of ways. These include geography, size of the fellowship, the demographics of the patients in the area that you're going to be treating patients, the type of hospital system, and obviously many more. How did you sort through a lot of these parameters when looking for a fellowship that fits your own interests?
So, how I started, well, I'm committed to both cardiac and thoracic imaging. So, I started by excluding the places that offered only thoracic or only cardiovascular fellowships. And then, since I'm pursuing an academic career, I just applied to big academic institutions that could offer me a great case mix and large volume of state of the art exams, and which, geographically speaking, ended up being a few in the West Coast and a few in the East Coast. I know that there are more, but like geographically speaking, and for my interest, that's what I wanted.
How did you find these different fellowships? From what I've encountered, are a lot of different online resources that are rather heterogeneous themselves in terms of the programs they include. And it becomes a little overwhelming to try to identify all of the programs that exist and then filter them out subsequently. How did you go about it, or what would you recommend in trying to identify fellowship programs that exist out there to see what fits other trainees?
I use the STR fellowship website. They have a link and they give an example of several fellowships. So I use that one. And at the same time, as I'm very committed already, I knew some attendings in different institutions. So I've been going to NASCI for a while. My first time I went to NASCI was 2012. So I knew already some of the attendings. So I went to the institutions looking for those attendings. That's how I did. But it's indeed difficult because probably I missed a lot of very good institutions in the way and I didn't apply to. But that's what the only source I had, the STR and my previous knowledge. So my attendings also used to tell me what good institutions were. They would ask me, geographically speaking, where do I want to go, and I would tell them like I'm open to the whole country for now. By that time, of course, and then they would tell me, oh, in the East Coast we have those institutions that will fit your profile. In the West Coast, you should go to those institutions, and so that's how we did.
Yeah, Clara, I think you've identified something really important for a lot of our trainees to start to work on even early in residency, and that's developing relationships with faculty members that may eventually lead to extensions and connections with other people in the community. While there may be a lot of cardiothoracic practicing radiologists and cardiologists out there, the community is relatively small. And for that reason, communication across institutions is a critical component, at least from what seems to be both of our perspectives, for identifying training locations that'll fit each individual person. Great. So, with that in mind, at what time during your training did you start reaching out to these fellowship programs? And, in retrospect, was it the right time or should you have done it earlier? Were you too early?
So I did not really reach out. Now, with these guidelines, I ended up sending the applications to the programs within the first week of August. Some residents sent all the applications on Monday. I ended up taking a few extra days, and it did not seem to harm me. I got invitations within a few days, except for one program that did not invite me until later. And sometime after accepting my fellowship offer, one attending asked me why I hadn't applied to their fellowship program. And then I told them that I was only looking for programs that had both cardiac and thoracic, and theirs only had one. They responded that they could have given me 2 months in the other specialty if I had reached out beforehand. So looking back, I should have reached out to programs that I was interested in, but had a deal breaker for me because they might have been able to accommodate that.
So, Clara, suspect that many trainees out there will have questions for programs about the style of program that they're able to offer, but don't necessarily want to commit to an application. In a certain sense, we can think of that as a cold call to a fellowship to ask some questions about that. And that can be rather intimidating both within and outside the world of imaging. Do you have any strategies for our trainees that may help them navigate that process of reaching out to programs, especially those with which they don't have a prior connection?
Yeah, I also felt intimidated, and to be honest, I still am. So, what I ended up doing was going to the NASCI conference and personally talking to different programs, to different attendings, telling them that I was applying to Cardiothoracic Fellowship, and they were all very receptive. And even invited me to apply to their institution. One even said that I should apply to their institution, and then I told him, yeah, I did, but I got no response. This is September, and I applied on August 1st. And in that specific case, what ended up happening was that my application got held with the coordinator and never got forwarded to the program director. So it proved to be good to introduce myself. Otherwise, I might have not gotten to be interviewed by one of my top choices. But it's hard because I did not did a cold call. I didn't know a lot of people, even though I was going to NASCI and they knew, because as you said, it's a very small community. They knew we were residents, so they were very approachable. But that's was the only form that I found to be able to connect and not do a cold call. And it ended up being very nice. I didn't apply for all those fellowships, but by going to that conference, I got approximately 15 invitations to fellowships. And then I started to be overwhelmed and I said like, thank you, I'm going to see. I don't know, but I think it was a good way to do it.
Fantastic. A couple of times in your responses thus far, you've noted society membership, academic society membership, as a critical component of identifying programs as well as determining what programs have to offer. Clearly, everyone is very excited about having a new member of the cardiothoracic imaging community, but you want to find a place that fits you best. So, our trainees can definitely take away from this that society membership plays a key role in evaluating the style of training that is out there and may fit you best, particularly the annual scientific meetings that come alongside of many of these academic societies. So let's shift gears just a little bit. Let's talk about the components of the application itself. There's the usual stuff, exam scores, your curriculum vitae, your letters of recommendation. But I wanted to know if there was anything unique that you provided or you've heard is provided alongside of applications to different fellowship programs.
I didn't hear about anything unique. The only thing that I did, and it was already expected, was I used my personal statement to talk about my prior experiences, including my previous radiology residency in Brazil, my research path at UCSF, my accomplishments during my surgical internship and during my residency. I used my personal statement as well to talk about the editorial board of the Cardiothoracic Imaging Journal, that I'm one of the trainees, but nothing very specific. I just did what they asked, nothing more. It's a lot of paperwork already.
Yeah, and that speaks to the burden on some of our program directors out there who have to sift through these applications. You want to be as impactful as possible. And it sounds like the approach you've taken, which sounds like a recommended one, is to be concise, utilize what it is that's provided, but still highlight the components of your career thus far that demonstrate your interest and also what you'd like to gain from their program. Great. A natural next part of the fellowship application process is the interview itself, and that's another very intimidating part for many people. There are certainly a lot of pieces of advice, sometimes black pearls, that people will give about valuable questions to ask there. I wanted to know if there were any very valuable questions that you asked when interviewing at the fellowships that you interviewed at.
Oh, there were a lot of, for me, valuable questions, like a lot. I talk a lot, so for me, it's easy to be in an interview because they just say talk, and I can talk for the next hour. But one of the most valuable ones, I asked if I would have dedicated time and sponsorship to attend and participate in national conferences without using my vacation time. I couldn't see this on websites. Actually, the fellowships, they present everything to you during the interview. So I didn't know this for a lot of the fellowships that I applied, and for me, it was very important to be able to go to STR, to NASCI, to RSNA, SCCT. One other important question for me was to ask about when and what fellows start to final sign. Like, do I start a cardiothoracic fellowship and have to final sign a cardiac MRI in the first month? So they were very nice to tell me how we would go slowly final signing chest radiographs, then more complex cases. Another issue that I made sure to ask was if I was going to be required to take calls in other specialties and final sign those exams. For example, having to sign a neuro case. I'm going to be doing cardiothoracic fellowship for 11 months, and am I going to be required to final sign them? There was one institution that required us to take several weeks of call, final signing exams across all specialties. And that for me was a deal breaker. So this was a very valuable one too. Other question that I made sure to ask, and they told us as well, was for fellowships that did not specifically offer interventional procedures. So I asked them how they would support me getting that additional experience. Am I going to have 1 month? How we are going to do this with IR so I can do lung biopsies or other procedures as well. And lastly, having the opportunity to talk to the current fellows was extremely important because I could be extremely straightforward and ask questions that I might not want to ask the attendings, and I did. And the other residents did as well. So we had almost 1 hour in one of the fellowship interviews that we could ask everything to the fellows. And I asked them how they felt supported by the faculty, how they felt about the fellowship environment, if it was malignant, benign, and if they could elaborate in the learning environment, how they felt when they were sick, and obligations that they might have that we just don't go there and ask to the attendee. So the interview per se was very important for me.
Excellent. You've touched on some things that speak to the type of career that you want to have in cardiothoracic imaging. You've mentioned already that you are hoping to pursue an academic position, likely at a large academic institution. There may be many trainees out there that have different goals, yet still have an interest in cardiothoracic imaging. As an example, there may be some trainees that want to enter the community, particularly rural communities, where they will be asked to perform far more than cardiothoracic imaging. In those cases, asking those same questions you did is key, but they may be looking for a different answer. They may be looking for the programs that offer, say, multidisciplinary, uh, multimodality, or even different organ system entirely opportunities in terms of call, rotations, whatever it may be. So great points. On the flip side of the questions, wanted to ask if there were any questions you asked that didn't actually help you. Were there any bad questions that came up during the interview process?
From my insight, I didn't think so, but I was very straightforward and honest. Nobody would tell me about, for example, sick days. So I would go there. I went there and I asked, how many sick days do I have? I already told them I have two small kids. I need to know how I'm going to be supported. And I know that a lot of people are afraid of asking this question. So I don't know how valuable it is, but at the same time, I already knew that my institution was going to take me in case I wasn't accepted. So I was bold enough to go there and ask. I asked about sick days, vacations, family leave, everything. I don't think that is that valuable, but I wanted to ask. I asked, how do we do if we get late? Not that I intend to. Those small details that are not in the website, and I could have just Googled it, but I had to ask. But I don't think that is very, very valuable.
Okay, fair enough. You just mentioned something that I think will be of interest to a lot of our applicants out there is how to approach the interview itself, not the questions, not with the specific program, but just the interview. How do you present yourself? Where are you when you take the interview? In the new, we'll call it a post-COVID era, if that's politically appropriate to say, but in the post-COVID era, many interviews are now virtual. For that reason, there's a lot of differences from the traditional in-person style interviews. For example, what sort of webcam are you going to use? What am I supposed to wear? Where in your place of living or other place are you going to have the interview? If we have concerns with regards to childcare, what am I going to do with my children during the time when I need to conduct these interviews? I was wondering if you could speak to some of these, if any, that you've encountered during your process, because I feel like you did primarily virtual interviews. Is that correct?
Yes, only virtual.
Got you. So, how did you approach some of these issues?
So I know lots of applicants, they adapt the lighting and they go really professional with their setup. The only thing I did, I took my laptop, I put over two boxes, just what I'm doing right now. I organized the bedroom and I closed the door. I asked my husband to take care of the kids, hide the kids, take the kids out. And I basically hid myself from my kids in the guest bedroom because there were some interviews that start at 8 and the bus doesn't come until, I don't know, 8:20. Not that it helped it a lot. My 4-year old ended up storming in and participated after saying to the attending that my husband had left her alone. He didn't. And she was just talking the interview and I was like, oh my gosh, what is going to happen with me? And I was apologizing and the attendee was very, very polite and he's like, no, that's okay. And I know that it did not affect the outcome because I ended up accepting the offer from that fellowship. So I think that this I wanted to share this to all the parents that are there because sometimes we try but we cannot do everything perfectly.
Fantastic. I think that's of critical importance to all of our trainees out there who are going to come from a variety of different backgrounds. So to hear that you can be a normal person and still do well in interviews is key. You don't have to you don't have to create yourself as something that you're not. So that's much appreciated. After the interview process, there are oftentimes a conundra that many of our applicants find themselves in where applicants need to coordinate future interviews with the deadlines for accepting positions that have already been offered. As an example, when you're in program A and program A has given you an offer for acceptance of that fellowship, but you have not yet even scheduled your interview for program B. Do you have advice for how to handle that situation that I know many of our applicants find themselves in?
So we were lucky not to have this problem this year. because of the 2022-2023 SCARD fellowship embargo guidelines. It made the process easier for us applicants. So the first day of interviews was November 7th, and we had until November 14th to accept or decline any offer made before November 14th. So what I and my colleagues did was schedule interviews very close to each other. What ended up happening is I decided a few hours after my last interview on that week, but I still had time. I was still within the deadline, the November 14th deadline. And so I just I accepted the offer. I told the other ones that I was not accepting, but I was still within this November 14th deadline. So the programs could still send an offer to others before the 14th. So I think that this was very helpful for us, because if we didn't have the SCARD guidelines, I am kind of insecure. I probably would have just chosen the first one.
Okay, well, good to hear. And in fact, this information is relatively new for me because when I was applying for my fellowship training, this was prior to the embargo. And for that reason, there was oftentimes a circumstance where I would be in that setting. Should I just accept the first offer, or should I potentially wait, negotiate that offer further? And that can oftentimes become very uncomfortable with your future colleagues to have to negotiate a position from not a tremendous amount of leverage. But good to hear that things have moved in a more favorable direction for our applicants in terms of selection of programs that best fit them. With that in mind, I kind of want to come to the close of our conversation and ask you, what about your upcoming fellowship are you most excited for?
I'm excited about the whole experience, actually. But I'm especially looking forward to the interventional pulmonary procedures that we will get to do on a daily basis, as they told me, from lung biopsies, fiduciary placements, and ablation procedures that I have never done. I'm also excited about having dedicated cardiac time and being exposed to state of the art imaging, technology, and research with a high case mix volume of exams, which I think will give me confidence, like a confidence boost, and prepare me well to when I become an attending.
Spectacular. Clara, this conversation has been great. Thank you so much for coming on board. We are really excited to have you in the cardiothoracic imaging community. And from all the listeners out there, I'm sure that they're very grateful for your insight and advice as to how to approach this intimidating component that is oftentimes necessary in taking that next step in joining the cardiothoracic imaging community. So thanks again, Clara.
Thank you so much for having me. It was wonderful.
All right. Thank you. All right. That concludes our conversation on the Cardiothoracic Imaging Fellowship process. I hope to make this part of a series on training in cardiothoracic imaging. Stay tuned for future episodes covering this topic and more in further detail. As always, thank you very much for tuning into the podcast. Please remember to rate, review, and subscribe to us. We will see you next time.